COVID-19 cases continue to rise across the nation, impacting certain racial and ethnic groups more than others. Joining us now to talk more about the disproportionate impact COVID-19 has on Asian and Pacific Islander groups is KUSI contributor Esther Valdes Clayton. Esther, good morning.
Good morning, Lauren.
So specifically, we're talking about Asian and Pacific Islander groups, and this is a growing population, one we're well familiar with here in San Diego County. Can you talk specifically about the groups that you're including in some of this data you're looking at?
Just like you mentioned, San Diego County is home to one of the largest Pacific Islander and Asian communities in the state of California and nationally. We're looking at 1.5 million people nationally. And here in San Diego County, less than 40,000 identify as Pacific Islander. They're comprised of 5 main subgroups, including Native Hawaiians, Guamanians, also known as Chamorros, Samoans, Javanese. So what we're doing is that we're separating the data, the COVID data, to drill down and see why Pacific Islanders and not necessarily Asians are being disproportionately impacted. For example, in Los Angeles County alone, the rate of infection is 6 times higher than the white counterparts. Here in San Diego County, just this morning, if you look at the San Diego County dashboard that identifies and breaks down the racial groups who have been affected by mortality and also just cases, the Pacific Islander grouping, even though it's less than 0.5% of the total population in San Diego County, they are disproportionately higher at the rate of cases per 100,000, surpassing Latinos, Blacks, Caucasians, and almost every other racial and ethnic group. So it was so impactful in the state of California when they saw this data, Lauren, that what they did is the UCLA initiated in the month of August a policy lab to study what are the factors, what are the underlying health factors, the social economic factors, and of course, the cultural factors that are causing Pacific Islanders in particular to be affected and have such a high mortality rate by coronavirus.
And so what were some of those factors that they found? Because among Hispanic populations, we could see clearly being essential workers, having multi-generational homes, people living together. What are the factors that we're seeing among the Pacific Islander groups?
Well, exactly right, Lauren. The real dialogue here, it's a story of economics and poverty. And one of the misrepresentations when we have these kind of conversations about which race, either Latino, Black, Pacific Islander, or Asians are being most affected, really it's a story of economics that sometimes the state of California and decision makers don't want to play up. Because what we really see is people who lack health care. That could be any color. It doesn't mean that you're more likely to get infected by coronavirus because you happen to be of a darker skin tone. It's because, like you said, you live with more people at home. In particular, Pacific Islanders, they tend to culturally aggregate. They're much more social. They're community oriented. They have multi-generational households where they're reluctant to have their elderly be in nursing care homes. They want the wisdom and the cultural values to be sent down from grandchildren to grandparents in a much more heartier fashion than their white counterparts. They tend to aggregate in churches a lot more, graduations as well. 25% of Pacific Islanders are also essential workers serving in the military, manufacturing, transportation. So when you have a younger worker leaving the household to go work and then come back, you tend to reinfect the whole household. Also, there's health factors as well. Pacific Islanders suffer from heart disease, diabetes, hypertension, asthma at far higher rates as well. And as I've pointed out before, when you look at a lot of our ethnic groups here in San Diego, a lot of us live in zip codes where Whole Foods and Trader Joe's isn't down the street, or the neighborhood isn't safe enough to take a jog around the park and just stay fit when they close the gym. This is really a story of economics and poverty and the lack of health care. And all of this were pre-existing social conditions that are now surfacing with coronavirus, where some communities are being disproportionately impacted. And it's a huge story, just like the previous story with the restaurateurs as well, that are feeling financial hits. the Pacific Islander community is not only being hit financially, but also disproportionately in terms of such a small population here in San Diego.
So I know the goal here is to really heighten the awareness of this specific subgroup and to highlight the needs and concerns among this community. So hopefully these discussions are happening at a much higher level. But Esther, always appreciate your insight.
Thank you, Lauren.
Absolutely.